Stanford Conversations in Menopause and Healthy Aging, the podcast, a trusted science-backed resource in menopause and healthy aging. When it comes to your medical and health education, tune in and submit your questions to world-class leaders in medicine and research. Stay informed, stay empowered, because your health matters.
Hello and welcome back to Stanford Conversations in Menopause and Healthy Aging, the podcast about living well through perimenopause, menopause, and beyond. I'm your host, Dr. Karen Adams, board-certified OBGYN and lifestyle medicine physician and director of the Stanford program in Menopause and Healthy Aging. Today, I'm back with part 2 of our 2-part series on all things sleep in midlife and beyond. Sleep is such an important aspect of our well-being, and we tend to struggle with it a lot in midlife. My guest for this series is Dr. Natalie Solomon, a clinical assistant professor in the Department of Psychiatry at Stanford University School of Medicine. She is a licensed psychologist and board certified in behavioral sleep medicine. Dr. Solomon and I do a lot of teaching of providers, but in this series, we are teaching you, the women who are going through it. So today in part 2, we're talking about treatments for sleep disturbance in perimenopause and menopause. Welcome back, Dr. Solomon. Thank you for joining me.
Thanks so much for having me. I'm really glad to be here, and I'm specifically excited to talk about treatment. Shall we jump right in?
Absolutely. Let's jump in. So, as I'm talking to my patients about this and just kind of starting on the surface, because obviously I'm not going to dive into it as deeply as you do, one of the things I want to discuss with them is sleep hygiene. And often people say, I'm doing it already. I'm doing it. So is there any value to sleep hygiene, and how should we be thinking about that?
I so appreciate this question. So sleep hygiene, as probably people listening are familiar, is kind of that popular list of recommendations to help your sleep. It includes things like, being thoughtful about caffeine intake, the timing of exercise and eating, having a sleep environment that's dark and quiet and cool. And each recommendation on the list is evidence-based. So, if someone looks at the list and they see something on there that could really help them in their sleep habits, it's an evidence-based recommendation. That being said, and this is the part I want to emphasize the most, it is not a treatment for insomnia. So sleep hygiene as a solo treatment, just offering someone those recommendations does not treat insomnia. And in fact, in insomnia research, we typically use it as the control condition because it really doesn't work to treat insomnia. And the trouble is many people have the experience that you described where they feel frustrated looking at the list because they've seen it before and they've tried those things before. Sometimes they also feel guilty because maybe they're not perfectly following every recommendation. And so I also like to tell people, those with insomnia and those without insomnia have the same number of sleep hygiene infractions, if you will. So it's normal that people break some of these rules. It's normal if you look at your phone in bed or whatever it might be. And so sleep hygiene, although evidence-based, is not a treatment for insomnia.
Okay. So we all should try to adhere to those to the extent that we can, but it's not going to really treat if we have a true sleep disturbance. So do you have a first line approach to treatment? What's the first step in treating these folks?
Yeah, so for those experiencing insomnia, the first line treatment is a treatment called cognitive behavioral therapy for insomnia, often referred to as CBTI. So again, that's cognitive behavioral therapy for insomnia. Cognitive behavioral therapy for insomnia is superior to sleep medications in terms of long-term success. And there are RCTs, so randomized controlled trials, looking at CBTI in women experiencing menopause and those experiencing daily hot flashes, and the treatment is still effective.
Okay, so is that really the approach for everyone, or specifically for perimenopause and menopause? Is CBTI effective for all people with sleep disturbance?
It is effective for people experiencing chronic insomnia.
Mm,
So, it depends a bit on what the sleep disturbance is,
mm,
but for those who are experiencing chronic insomnia, it is the best treatment.
mm. And what is exactly does that look like? Can you explain to us what CBTI is?
Yeah. So it's a non medication treatment, not meaning you can't be on medications. Most people are on
Mm,
medications, but meaning that no new medication will be introduced. The treatment lasts about 6 to 8 sessions. So you meet with a provider, 6 to 8 times, and meetings tend to be weekly or every other week. So you can think of this as kind of like a 2 month treatment. And the treatment really focuses on leveraging one's natural sleep systems. So, in these meetings, you come up with an individualized plan for your sleep. So, it involves things like an individualized bedtime, rise time, how to navigate awakenings. So, kind of specific tools to navigate sleep disruption.
hmm. So my CBTI prescription may look different from someone else's?
Absolutely. Almost everyone I work with has a completely different treatment plan.
Oh. Oh, that's really interesting. I didn't realize that. So it really is individualized. And do you use that in and of itself, or do you sometimes use it in combination with other treatments?
Yeah, it can absolutely be used in combination with other treatments. So, an example that's coming to mind for me is hormone therapy.
Mm,
So, CBTI is the best treatment for insomnia symptoms, and hormone therapy is the most effective treatment for menopausal symptoms.
mhm.
So, it would be quite common, especially if someone was experiencing, for example, frequent or severe hot flashes and experiencing insomnia, that they could both be engaged in hormone therapy and CBTI.
hmm Right. And that is something that I often will consider is if someone is going to be initiating hormone therapy, then I might just wait for 6 weeks or so and see how their sleep responds because I know that some of that hormone therapy is going to hit the sleep centers of their brain. And the side effect can be drowsiness, which is fantastic if you take it at night. I always caution people not to take it in the morning because it can cause drowsiness. So that makes a ton of sense. What other treatments would you consider potentially for insomnia?
Yeah, so there are sleep medications, and they come in many different kind of categories. So sometimes people take benzodiazepines, sometimes people take antidepressants, sometimes people take antihistamines. For sleep medications, and we can talk more about this, many of them are not indicated for long-term use, but they
Mm,
might make a great deal of sense in the short term. So that's kind of one camp that people can consider for treatment. If one is not a good candidate for hormone therapy, they might consider, let's say, SSRIs or gabapentin to address menopausal symptoms outside of hormone therapy.
mhm. Absolutely, those can be so beneficial. I worry a little bit about my patients being on Ambien or Trazodone or something like that. Are those used kind of in a very limited way, or might you maintain someone on something like that long term?
Yeah, so they're really not indicated for long term use.
Mm,
That being said, often people end up taking them for sleep longer than they would like to, in part because of difficulties accessing other aspects of sleep treatment.
mm,
So the concern is both short term, there are some short term concerns as it relates to sleep medication, things like fall risk, as well
mhm,
as long term concerns, things like the development of dementia.
mhm,
So, I always like to think about if someone is interested in tapering their sleep medication, that's something they can talk to their prescriber about. They can do it gradually. You can also engage in CBTI with your goal to be a medication taper. So many people I work with are taking a sleep medication, and their ultimate goal is to sleep well without it. And so you can engage in CBTI and kind of complete a slow taper through that process.
mhm. Right. And how would someone go about finding a CBTI practitioner, someone who could help them with that process?
Yeah, it's a great question. So, one is you can you can look on Google for providers who offer CBTI. If you're connected to a larger medical system like Stanford, you can ask your provider for a referral to CBTI. There's also a directory online, both within the United States and internationally. It's hosted by University of Pennsylvania. So if you look for the UPenn CBTI provider directory, you can find a provider in your home country or home state.
Great, great. And, I think many of my patients tell me they do mindfulness techniques. Is mindfulness different from CBTI?
Yeah, mindfulness is different. So, mindfulness can be a component of CBTI if indicated, but I would say it's also separate in that CBTI involves many other components, and mindfulness or meditation is its own skill. Mindfulness can be helpful for sleep, and you want to be careful that it doesn't become a form of sleep effort. So, what I mean by that is some people experience huge benefit using mindfulness or meditation in that it kind of helps them rest and be in a more sleep compatible state, if you will. Other people feel frustrated because they're hoping the mindfulness will make them sleep. And when we try to make ourselves sleep, we actually are putting in a lot of effort and becoming less and less sleep compatible. So I think it's a wonderful tool, especially if framed as something to help kind of down regulate and rest.
Right. I've heard you talk about that before, that sometimes the behaviors that we start doing actually make sleep more elusive for us rather than bringing it back closer. And can you talk a little bit about that? I think that it's almost like that, don't think about an elephant. And then
Yeah.
what immediately happens is you think of an elephant. So how can we make sure that our behaviors are not working against us?
Yes. I mean, if I was going to give anyone just one piece of advice, including myself, it would be something along the lines of not to chase sleep, but to let sleep come to you. So there's this term called sleep effort, which refers to when you're trying very hard to make yourself sleep. It's kind of like being stuck in quicksand. The more you struggle, the more you sink. The more you try to force sleep, kind of the more effort you're putting in, and the more activated you might actually become. The way to get out of quicksand is actually to kind of stop moving, right? So I'm not suggesting you have to lay in bed and stop moving, but actually the opposite, to stop struggling with sleep and to do something else relaxing and wait for sleep to come to you. So that could be reading, that could be watching an episode of TV, that could be cooling down after a hot flash, having a glass of water, or even just a sip of water, right? And so sleep does always eventually come, and our efforts to chase it seem to push it further away.
Right, right. Exactly. Because, we talked in part one about mood and sleep and how anxiety can really aggravate or be additive to sleep disorders. So, how do you talk with people about that? How do they work with that kind of voice in their head that's making them more anxious when they're trying to chase sleep?
Yeah, there's kind of a number of tools. So, some of it is identifying if a person feels daytime anxieties coming up at night, like thinking about work or your family or your health, or if someone notices a lot of the anxieties about sleep itself, like how will I function tomorrow? Is this going to hurt my overall health? Things like that. Depending on, and maybe it's both, right? But
Right.
depending on the specific context of a person's anxiety, I might address it differently. So if a person's worried about kind of daytime functioning, I might actually suggest that they find a pocket of time during the day to do constructive work on their worries, which sounds very funny, but to actually take some time during the day to maybe write down the two things that are on your mind. And for each one, perhaps they would write down what's in and out of their control.
Mm.
And then if concerns come up at night, I encourage people to remind themselves my brain is not doing good thinking now anyway. Like, this deserves my daytime brain, and I will look at this in the clear light of day tomorrow. So, in other words, even though you might not be asleep, your most reasonable mind might be offline. So, that's one of many tools to kind of address daytime worries that come up at night. If one is worried about sleep itself, I like to actually talk about some sleep science. so that they can have a better understanding of what's happening with their sleep and what kinds of changes would be productive to their sleep. But I also like to look at the data at how they have functioned on suboptimal sleep before. So for people who struggle with their sleep, let's imagine we have a midlife woman who is really struggling with her sleep and has been struggling with sleep for a few months now, or even a few years. Often looking at these past few months or years, she's often impressed to see that her performance has largely been intact and that some way, somehow, she always finds a way. And so I want her to remind herself of that at night, which is, I don't need to suffer more by worrying about tomorrow. I seem to always find a way. And I'm actually more likely to sleep well the next night, in a large part because I'll be sleepy, right? So some of it is just kind of how can we work with these sleep concerns as they come up at night?
Mm-hmm. Oh, I think that's so helpful because it is true. If you didn't sleep well the night before, you have more of a sleep drive for the next night. So hopefully you'll catch up a little. What about if she thinks to herself, I have kind of a light day tomorrow. Maybe I'll just grab a nap midday. Is that a good idea or not a good idea?
So it really depends on the timing and the duration of the nap. So I kind of think of napping like snacking. And, it's not just a metaphor. Sleep is a homeostatic process like hunger, as in when you're hungry and then you eat, the only way to get hungry again is basically time. And when you're sleepy and then you sleep, the way to build up your sleep appetite again is time. And so it's not that all napping is bad, but if you have a bagel right before dinner, you'll kind of spoil your appetite for the nighttime meal, if you will, the nighttime sleep. So this is a long way of saying short naps earlier in the day. So naps around 20 minutes, at least 6 hours away from bedtime, might help a person feel refreshed and might not harm their nighttime sleep, or unlikely to harm their nighttime sleep, versus naps closer to bedtime. Even light dozing in the hours leading up to bed might really compromise a person's nighttime sleep.
That makes so much sense. I do have to ask about CBD products because some of my patients just say, all I need is a tiny little bit and I just sleep great. Is there any science behind that or any guidance we can offer to our patients?
Yeah, currently the literature is quite mixed. So there is not yet scientific consensus enough to recommend these products. I'm kind of excited to see what the future holds in terms of research, but currently there are studies showing benefits of sleep of CBT. There's also studies showing CBD harming sleep either in the short term or the long term. And so at this point, it's still quite mixed. And then because CBD products are not kind of controlled by the FDA in the same way as other medications that we take, there's also some concerns about composition and dosage of these products.
And purity and all of that.
Exactly.
Exactly. Along those lines, any supplements that you recommend for helpful sleep?
It's similar. There's some supplements that have become quite popular for sleep, but there's not quite literature to support their popularity at this point. So, often I see magnesium or melatonin taken for sleep, and there's often melatonin is taken in such high doses that I'm actually not sure if it's helpful or harmful or none of the above. So it's a long way of saying, at this point, the literature is not quite there to recommend these supplements.
Right, right. I've heard that as well. That's usually how I advise my patients. Well, finally, as we're looking forward with our patients, as they're going through this menopausal time frame, will things just get better with time? Or is this something that is kind of a new normal for menopausal people, that sleep is just elusive?
Mhm. So, I would say there are multiple, sometimes overlapping causes of sleep disturbances in midlife women. And so, for some women, these sleep disturbances will be transient and they may not be associated with daytime distress or impairment. So, they might not require any active treatment and they may really resolve with time. However, for others, they may experience more severe sleep disruption and it's impacting functioning and quality of life and really necessitates its own treatment. So, unfortunately, I have to say it depends. And if something we've said in this podcast makes one think that they have a sleep disorder, whether that's sleep disordered breathing or insomnia, it might be worth seeking treatment.
Absolutely. That's such an important message because I think saying, well, this must be my new normal, without really investigating it may lead you down a path of suffering that's unnecessary. So I once again so appreciate the expertise of my colleagues at Stanford, you including Dr. Solomon. I always learn so much from you. And especially I think when there's so much misinformation out in the world, it's so important that we can have these kind of conversations so that people understand what is evidence-based and where the science is at this point. So we will keep doing our best to cut through that noise and provide that information to folks. So thank you so much for sharing your time, your wisdom with us today. It was really wonderful.
I so appreciate you having me. And, I really think sleep disruption in the context of menopause is often minimized. People
Mhm.
really think, okay, maybe this is just how it goes. And that's really not true. There is treatment that has been shown to be effective. I also think when people are struggling with their sleep, they're quite vulnerable to all the products. We're sold lots of things. And so I think it's nice to really have a cautious eye when you're looking towards products for sleep and really thinking about what's likely to help you and what's just being marketed to a somewhat vulnerable population.
Absolutely. Such a great point. Thanks so much again. And thanks to you, our listeners, for joining us here on Stanford Conversations in Menopause and Healthy Aging. We will see you next time.
If you've enjoyed this episode of Stanford Conversations in Menopause and Healthy Aging, please take a moment to follow or subscribe to our podcast on your favorite platform and consider leaving us a rating or review. It's a simple, zero-cost way to support our work and help others discover the show. You can also stay connected with us on Instagram, YouTube, and other social media at Stanford Menopause. For additional resources, event notifications, and other updates, be sure to visit our website, menopause.stanford.edu, where you can also sign up for our program newsletter. Thank you for joining us, and most importantly, thank you for your interest in advancing the conversation around menopause and healthy aging.